I'm going to be doing my prenatal education video. Before I start, I'm in my Nightingale uniform. I have my badge, no nail polish on my nails. I'm going to do a quick room scan. So I'm going to enter my patient's room, introduce myself, do hand hygiene, provide privacy, check my patient's name and date of birth against two patient identifiers, and then I'll start my education. Hi, I'm Nurse Michelle. I'm going to be going over a few things about your pregnancy today. So I want to start off with how often we'll be seeing you. So you're going to have a lot of appointments throughout your pregnancy. So you're here for your initial visit today. So after today, we're going to be seeing you every 4 weeks up until you're about 28 weeks. Then after that, we'll see you every 2 weeks. And then when you're 36 weeks, at that point, we'll see you weekly up until you have baby. So when you come in for these appointments, there are a few things that we always do. We'll check your vital signs, check your weight. We'll do a urinalysis just to see if you have any protein or sugars or signs of infection in your urine. We'll look at your belly, do a fundal measurement, and then we'll listen to baby's heartbeat. It's non-invasive. We just put some gel on your belly and we just use a little Doppler to listen to baby's heartbeat. So today for your initial visit, we're going to look at your medical history, family history, any information about your past pregnancies. We're going to look at medications you're taking, if you have allergies, just do kind of a full assessment. Also during this visit, we can give you an estimated due date, and then we'll also order some routine blood work just to kind of get an overall look at your health. So we'll do a CBC with diff, a CMP, we'll look at your blood type, your RH immunity. We'll do some STD testing. If you're overdue for a PAP or you haven't had one, we can do that here today. So it's kind of like your initial visit. So there's a lot of testing and things that happen. So I like to kind of break it down by trimester. So you're in your first trimester right now until you're about 13 weeks. So in the first trimester, we also do what's called a dating ultrasound. It's a very simple ultrasound, but we just look at the baby's heartbeat and then we can get a more accurate estimated due date with that ultrasound. And then also in the first trimester, it's completely optional. The physician will talk to you about it. But there's an option to do some genetic testing. It's called NIPT testing. So it looks at some chromosomal disorders, things like Down syndrome. Again, it's completely optional and it's something the physician can talk to you about. It's a blood draw. So that happens in the first trimester if that's something you're interested in doing. So after the first trimester, when we get into the second trimester, when you're between 14 and 27 weeks, usually about 22 weeks, 18 to 22 weeks, we do what's called an anatomy scan. So that's a very detailed ultrasound that we do on baby. So in that ultrasound, we look at the baby's organs, we look at amniotic fluid, we look at the placenta, we look at the cervix, and then in that ultrasound too, we can see baby's gender usually. So if that's something that you're interested in knowing, we can usually tell you in that appointment. Another thing that happens in the second trimester is we do what's called a blood glucose tolerance test. So with this test, we have you come in, you drink a sugary drink, and then after that, we have you wait a little bit, and then we draw your blood. And then depending on what your blood sugar level is, we can kind of determine if you have gestational diabetes or not. And then also in the second trimester, the physician might order another CBC and CMP just to kind of see where you're at. So that's usually what happens in the second trimester. And then when we get into the third trimester, which is between 28 and 40 weeks, we'll do a Tdap vaccine, or we'll offer you the Tdap vaccine. So that's to help prevent baby from getting whooping cough. And then also in the third trimester, we do what's called a strep B testing. So it's a swab, it's a vaginal and rectal swab. So that just checks for bacteria that may affect the baby when the baby's born. And then for the most part, if your pregnancy is going well, we won't do any other further testing. If for some reason the physician is concerned or you're having a high risk pregnancy, we do what's called non-stress testing. So it's non-invasive. You just come in, we put a belt on your we put a belt on with some sensors when we just listen to baby and look at baby. And then also we might do some growth ultrasounds depending on what's going on, but that just depends on how your pregnancy is going. So that's kind of an overall of kind of how your pregnancy will go as far as visits and testing. So now I want to move into something that's also very important during pregnancy, which is nutrition. So during your pregnancy, would just recommend that you try to eat a well-balanced diet. So you want to eat fruits, vegetables, proteins, grains, calcium, dairy, healthy fats. You just want to make sure you're getting a well-balanced diet. We also recommend that you take prenatal vitamins just to kind of help with any deficiencies that you might have. Prenatal vitamins, especially, they have folic acid, iron, vitamin B, vitamin C, calcium, just all of those things that we need for you and baby to grow and for you to be healthy. And then also, we just want to remind you to kind of stay away from things that are undercooked. You want to make sure everything's cooked well. You want to stay away from really high mercury fish because that could have a negative effect on baby. And then also just staying away from alcohol and, any kind of substances during your pregnancy. So along with nutrition, we also recommend that you try to exercise at least, 5 days a week for about 30 minutes. Nothing strenuous, low impact exercising, things like swimming, walking, yoga. All of those things are good. You want to make sure you're not overexerting yourself, you're staying hydrated, you're listening to your body. The kind of exercise you want to stay away from is anything that can cause trauma, falls, or just anything that's really high impact, like lifting heavy weights. You want to not do cycling. That can be pretty intense, and sports that you could get injured in, like hockey or soccer, something where you can have like a ball thrown at you or anything like that. You just want to make sure that you're safe, but always just kind of listen to your body, and hydration is very important. So from exercise, we also kind of want to go over weight gain. So of course, with pregnancy, we expect weight gain, but there's just some parameters we like to kind of go over with you. So if you're considered underweight, so if your BMI is less than 18.5, we want, or we're looking at about 28 to 40 pounds of weight gain that we would like. If you are in the normal range, which your BMI is 18.5 to 24.9, then we're looking at 25 to 35 pounds of weight gain. If you're overweight, your BMI is 25 to 29.9, then we're looking at 15 to 25 pounds of weight gain. And then if you're obese, which is 30, BMI of 30 or greater than 30, then we're looking at about 11 to 20 pounds of weight gain. So this all depends on your BMI, but we just like to kind of give you those numbers so you kind of have a healthy range of the weight gain that you should be in between during your pregnancy. And then I just want to talk about some common complaints during pregnancy. The most common one would be like morning sickness, which is like nausea and vomiting. So with nausea and vomiting, morning sickness, which usually happens in the first trimester, just some tips to help with that is you just want to stay very hydrated. You want to make sure that you're eating something when you wake up in the morning. Have some crackers on your night table to kind of help. And then just kind of eat small, frequent meals. That usually helps with the nausea and vomiting. Another common complaint during pregnancy is heartburn. So some things to help with heartburn is to kind of stay away from really greasy foods, really spicy foods. When you eat, you want to try to not lay down right away. And if you're having a lot of heartburn too, you can also like sleep with a pillow, kind of sleep up a little bit. And that usually helps with heartburn as well. And then another complaint, which usually happens maybe in your second trimester or toward your third trimester when your belly starts getting a little bigger, is back pain. So some things that can help with back pain, they sell belts belly belts, and you can put that kind of helps support some of that weight from your stomach. That helps alleviate some back pain. Some other things that help with back pain is stretching. There's also pregnancy pillows that kind of help when you sleep to kind of support your belly as well, and that helps with back pain. And also doing like warm compresses, nothing hot, nothing on directly on your belly, but warm compresses on your back also can help with back pain. And then lastly, I just want to talk about some major warning signs that you want to look out for during pregnancy. That would be major red flags that you would want to come in and let us know right away. The first one is vaginal bleeding. So vaginal bleeding can mean a lot of things. In the beginning of your pregnancy, it might mean a miscarriage. Later on in your pregnancy, it might be like a early labor. It might be some issues with your placenta. It could be a lot of things. So if you're having any kind of vaginal bleeding, you want to let us know and come in right away. Another major warning sign is if you're having severe headaches, any changes with your vision, that might be a red flag for preeclampsia, which is high blood pressure. So that's something that we definitely want to address and take care of right away. So that would be another major warning sign. And then another major warning sign during pregnancy that you might have is a decreased fetal movement. So that might happen, towards the end of your second trimester, more in your third trimester. So if you notice that you're not feeling baby moving as much, or you're not feeling baby move at all, or something just seems off and not like the usual, you want to come in right away. That might mean maybe the baby's in some kind of distress, or there's just something going on. Sometimes it's not, but we rather just get it checked out. So that's definitely something that you want to come in for and call us right away if you're having any decreased fetal movement. So I know it's a lot of information, but if you have any questions or anything, we're here for you. Thank you.